I'm seeing this patient over here. Thank you. Hello, hello. How are you today? Awesome. My name is Lee. I'm the MA that's going to be taking your vital signs and just sort of identifying what brought you into the clinic today. How are you feeling overall? Are you doing okay? Oh, that'll do it for sure. And how long has that itchiness been going on for? A few days. Okay. Like, would you say okay. Gotcha. Any burning, abnormal discharge? It's kind of like a white, thick discharge. Some burning after, like when the pee touches? Okay. But you're not peeing more often or... Okay. Only with the skin contact. Gotcha. Do you feel swollen down there at all? You do. What was that? You tried an over-the-counter treatment? Okay. And what did you use? The Monostat one a day? Okay, so just the one-time treatment. Gotcha. Okay, and before all of those symptoms started, was there any new products that you used? Any new medications that you've been on? You had, tooth infection. They gave you antibiotics for about a week? Okay. Gotcha. Alright, good to know as far as history. Has anything like this happened to you before? I realize you took a yeast treatment over the counter. Have you ever had a yeast infection? No, you saw TikTok? Gotcha. Okay. Totally understandable because once those symptoms start, you're just like wanting it to go away as fast as possible. So I completely understand. Any vaginal odor at all? Okay, and are you sexually active? You haven't been for a few months? Okay. And do you know roughly when the last time was that you've been screened for a sexually transmitted infection? Okay, so you stay pretty up to date. Okay. Yeah, no, we can definitely help take care of this for you. I mean, are you comfortable getting a pelvic exam today? You are. Okay. Awesome. And roughly how tall are you? Okay. And do you know your weight by chance? Okay. All right. So what I'm going to do is I just have to take your blood pressure and do your temperature check. I'm going to input all this information into the computer that I have here. And then we'll have Leanna, the PA, come in and do the exam for you and just get any tests that you might need. Yeah, awesome. So here, let me just type up some of this information now. Put it down here. Give me 1 second, okay? Just gonna put it in the system now so they know that you're here. You took Monostat. The one treatment one day. Yeah. You know, I've heard that from a few people that took the 1 days over the counter, that it just feels like a bomb went in there and it hurts. And for a lot of patients, they come in saying that they feel worse than when they started. Yeah, for sure. I'm sure Leanna, the PA, will talk to you a little bit more about that, so nothing to worry about there. It looks like they already have a chart for you in the system. No changes to your medical history, surgeries. Okay. No change to your smoking status. Okay, just making sure. And are you on any forms of birth control right now? Natural family planning? Lovely. As well as barrier methods. Okay. Gotcha. Okay. Awesome. All right, so let me get your vital signs here, and then we will bring Leanna in. Let me just put some hand sanitizer. if you could just rest your feet flat there. Alright, we'll do your blood pressure first. Let's get this going. I'm just going to slide this on this arm here. Make sure it's nice and snug for you. Okay. Give me 1 second. Let's see. Right, blood pressure is normal. Let me get that air out for you. And if you wouldn't mind just letting it out. Perfect. Let me get this closed up here. Alright, next thing that I have to do is just check your temperature with it being flu season and all. I feel like ever since COVID, things just haven't been the same in that regard. Great. Yeah, it's definitely been crazy. And this is going to go just underneath your tongue. There you go. Very good. I'm going to take that out there. Probably shouldn't touch that. There we go. I'm going to just dump that. Garbage. Alright, so vital signs look good. So with that being said, let me get you a little drape so that you have it when Leanna comes in. You're just going to lay down on that medical table over there behind you. And then I have this drape for you. You are just going to want to get undressed waist down. Everything top-wise can stay on. And just to confirm you're okay with a routine pelvic exam, which is when she'll look on the outside, take a speculum, look inside, and then a manual exam with her glove to feel for masses or tenderness. Awesome. And I know you haven't been sexually active. Do you need any STI screening today, or just kind of assess the situation only? Perfect. Just want to make sure. Leanna, the PA, will go over everything that she will be testing for with whatever swab she chooses to do. But I'm going to give you some privacy. This is for you. And then, like I said, you'll just get undressed waist down. Leanna, the PA, will be in shortly. I will go take your chart for her. You're already logged into the system here, so I will leave this for Leanna, and then she will see you very soon. Coming in. Hello, hello. How are you today? Good, good. My name is Leanna. I'm the PA that's going to be addressing your concern today. Lee, the medical assistant, was telling me that you recently took an over-the-counter medication to treat a yeast infection. And you felt like the symptoms made it worse. Or sorry, the treatment made the symptoms worse. Okay. And that was like the monostat one applicator. Okay. And you've been having like kind of, it sounds like, all the symptoms with the yeast infection, right? You've been having itching, swelling, that white, thick, clumpy discharge. Okay. And sorry, how many days has this all been going on for? Okay. Lee was recently telling me that you were undergoing like a recent tooth infection and you were taking a course of antibiotics. Okay. So after you took the antibiotics for the toothache is when the symptoms started? Gotcha. Yeah, definitely not surprising considering I find that that's like one of the most common reasons people get yeast infections. Do you normally get a lot of yeast infections, or this is your first one? All right. Well, if it's okay with you, I was just going to do a quick pelvic examination. I'll just turn on the light here, just examine the outside area, make sure I don't see anything new as far as moles or lesions, and then we will take the speculum and do an internal exam, and I will just be collecting a specimen vial to send out to test for BV, which is a really common pH imbalance, yeast infections, and it also can break down the type of yeast infection, as well as trichomonas that just comes on there. And you haven't been sexually active recently, so you don't need any STI screening today, right? Okay. And just to confirm, no urinary symptoms, frequency, urgency. Okay. Sounds good. So let me just put this here on my table, and I am going to put some gloves on. Yeah, I always tell my girls that if it's the weekend and you feel like you have a yeast infection, you want to treat it over the counter. Although it's annoying and not as quick, you'll want to do the 7-day, or like one applicator once at night for 7 nights. My go-to is clotrimazole cream. So I highly recommend it in the event that you can't make your way to the doctor's. Usually the 1 and the 3-day strengths are so powerful. That's why people end up feeling worse. It's just too high of a dosage at only a few times versus like a good steady dose over the course of a week. Of course, it's probably more ideal just to come in because it's one pill that we prescribe you and then it's all taken care of. Exactly. All right. I am going to turn on the light here. And then you are just going to feel my gloves here. I am just taking a quick look on the outside, making sure I don't see any suspicious lesions or anything else that could really explain the burning and irritation on the outside. Okay, outside exam is completely normal. I'm going to take the speculum now and put some lubricant. Okay, you're going to feel some cold here, okay? Cold pressure. Yep, so I definitely see like that white thicker discharge that you were talking about. I'm just going to collect a couple swabs here. Almost done. Let me just mix these in the little vial container here. I'm going to just close that. I'm going to take out the speculum here. Okay, this is coming out. Then the last part is just doing an exam for tenderness. You could always decline it if you're opposed. You're here anyway? Okay. So I'm just gonna put more lubricant on my gloves here then. Alright, you're gonna feel a lot of pressure. No pain, right? Okay, removing my gloves. these off here. I'm gonna turn off this light. Very good. So, just as you were suspecting, definitely is a yeast infection. Right now, I'm gonna write you a script to pick up a diflucan pill, or what they call fluconazole, at your pharmacy. Do you have a preferred pharmacy for this prescription to go to? Okay. And what city is that in? Okay. And do you by chance know like the main crossroads? Okay. So yeah, I will send a script there for you. So I'm gonna have the girls get that taken care of. Really, also at checkout, the girls will give you some information on how to prevent yeast infections. Of course, when you're given strong antibiotics for like a throat infection or a tooth infection, it can be a little bit inevitable. Definitely just keep an eye on it and see if it does become a recurrent theme whenever you do take antibiotics, or if it's a specific type of antibiotic that causes that yeast infection. Absolutely. Is there any other questions that you have? Any other concerns? You're all set? Beautiful. Well, I am going to give you some privacy then. You can get dressed and then you can leave through this room, and then you'll see the girls at the front desk and they'll give you all of your information as well as the script for the pharmacy. Not a problem at all. It was very nice to see you. You call me if you need anything, okay? Awesome. All right, I'll give you some privacy now. Lee was also telling me that, what was Lee telling me? What was she telling me? What was I telling myself? What was Lee telling me? Oh, that you recently... Lee was recently